And I've helped a lot of people, some friends right here on this app, people I've met that I'm now friends with patient advocacy, because I pretty much only do pro bono cases now, because I just don't have time to maintain clients and do marketing. Marketing is a whole thing. But oftentimes, the number one issue is I don't understand what's going on. I'm being discriminated against. I'm not being treated properly. They're not really addressing my concern. They're dismissing me. They're not addressing my pain. Um, I've told them my site hurts. I'm not getting my medications on time. The staff was rude. I'm not getting up. My mom's not getting up out of bed. Whatever it might be, right? So it's really important that you understand what the care plan is. Every hospital pretty much now has a whiteboard. So it's important that nurses, this is your obligation. Update your whiteboards, nurses. Update your whiteboards with the plan and do education with your patients. And make sure you document that in the chart. Now, for the patients and the family members, if you feel like your issues are not being addressed, one, have a concrete, specific, concise list or have it summed up in a big way. We don't want to hear a bitch session, just saying. So let's just get what is the point and what is it you want concretely. Address that with the nurse. If it's something they need to go up to the doctor about, then ask them to do that and message the provider, because the providers are not there on the unit. Very rarely is that going to be the case unless you're in sometimes an ER or ICU. And if you still don't get satisfaction from that, then you can escalate that and ask to speak to the charge nurse. If you still do not get a satisfactory response, then you can ask to speak to the house supervisor. Now, this might be also called the administrative director, but who's in charge of the house, right? And this is a foreign concept. The public does not know about this rather secret role that every hospital has 24/7. These are not the vice presidents, the presidents, the C-suite. This is an individual who's in charge of basically the operations of the hospital and the flow of patients and what's going on in the hospital day to day. And usually it's a 12-hour shift. And this is usually the person who's really in charge for sure on weekends and nights and holidays. If you still cannot get resolution, you can then ask to speak to the administrator on call. Now, this is a C-suite individual, typically somebody in senior leadership who is on call 24/7 after hours. So, after 4 p.m., whatever, 8 to 4, Monday through Friday, there's an administrator on call. So that would be the top person. Now, depending on what state you're in, there are other ways to go. In California, you have some other avenues. But within that hospital system, that is the chain of command. So understand what that is. It's really super important. And obviously be respectful the whole time. And understand that if you get an answer to your question, that is your answer to your question. Nobody's going to be able to address or unwind whatever distress or grief or any of that you've suffered or you say you've suffered or whatever's happened, right? We can apologize, try and make amends, but make sure that you understand when there's a resolution and what that resolution looks like and that the issue is complete, okay? So that's just some tips. So make sure that, remember the chain of command. Did you hear me mention a doctor one time, provider one time? They are not in that chain of command. It is your primary nurse, the charge nurse, could be the manager of the unit. So I did skip that step because I'm assuming we're talking about after hours. The manager or director of the unit, the house supervisor, and administrator on call, AOC. All right, you guys, let me know if that's helpful or not. Leave a comment. Let me know if you've done that before, followed that chain of command, and how did it work for you? And have you tried other methods of getting, what you need when you're in a hospital, your loved one is in a hospital? But again, let's be reasonable. Hospitals are severely understaffed, so it is important to understand that we are treating the thing that you were brought in for. We're not treating 50 other things that you haven't sought medical care for.